There is a number missing from almost every retirement plan I have ever seen. Not a small gap. We are talking over $300,000. The standard advice is correct. Figure out your annual expenses. Multiply by 25. Invest consistently. That math works. But it has one enormous blind spot built into it. Healthcare in retirement. Not your premiums while you are working, the costs after your employer stops covering you. Before and during Medicare. This is the number that wrecks retirement plans that look fine on paper. In this video, the exact math behind this gap, why it keeps getting left out of retirement planning, and 5 concrete steps you can take right now. Here is why this cost keeps getting missed. When you build a retirement budget, you estimate based on your current bills. But your current healthcare bill has a hidden subsidy baked in. Your employer is covering 50 to 80% of your premium. Remove that employer subsidy at retirement, and the number does not shift a little. It can triple or quadruple overnight. Most retirement calculators never flag this because they let you enter one number for expenses. The other reason it gets missed. Healthcare costs grow at 4 to 5% per year, faster than general inflation. A budget built on today's premiums is significantly wrong by the time you actually need it. And then there is Medicare, the assumption that fills in the gap for most people. Most people assume Medicare means free healthcare in retirement. That assumption is costing people hundreds of thousands of dollars. Fidelity publishes a retiree healthcare cost estimate every year. Their current figure, the average couple retiring at 65 needs $315,000 just for healthcare, top of housing, on top of food, on top of everything else. $315,000, just healthcare. Spread that over 20 years, and you are looking at $16,000 per year, roughly $1,300 a month, just for healthcare costs. Medicare is not free healthcare. It is a government insurance program with its own premiums, deductibles, copays, and very significant coverage gaps. Here is what that actually looks like. Part A covers hospital stays. If you paid payroll taxes for at least 10 years, you owe no Part A premium. That part is fine. Part B covers doctor visits and outpatient care. The standard 2025 premium is $185 per month per person. For a couple, that is over $4,000 a year before a single appointment. After your deductible, Medicare pays 80%. You pay 20%. There is no out-of-pocket maximum on that 20%. That gap is unlimited. A $50,000 hospitalization leaves you with a $10,000 bill. Out of pocket. No cap. This is the exposure most people do not know they have until they are sitting in a hospital. Part D covers prescriptions. Its own separate premium, its own formulary, which means your specific medications may or may not be covered depending on the plan you choose. And then there is what Medicare does not cover at all. Routine dental care, routine vision, hearing aids. 3 of the most common expenses people face in retirement, completely outside Medicare. There is a solution for the unlimited 20% copay exposure. Medicare supplement insurance, also called Medigap. Plan G is the most popular option. It covers almost everything Medicare leaves behind. Budget roughly $150 to $200 per month per person for a Medigap plan, depending on your state and when you enroll. Lock it in early. Premiums are medically underwritten after your initial enrollment window. So Medicare with Part B plus a Medigap plan is real money every month, but it closes the catastrophic exposure. That is the trade-off you are making. Now the early retirement trap. If you are planning to retire before 65, this section is specifically for you. Medicare eligibility begins at 65, not 62, not 60. If you retire at 60, you have a 5-year window with no employer coverage and no Medicare. The most common bridge is ACA marketplace coverage. A 62-year-old couple in a mid-cost state can pay $1,500 to $2,500 per month before any subsidies. That is $18,000 to $30,000 per year, just for insurance. Before a single doctor visit, most early retirement budgets do not have a line item this large. The good news, RVA subsidies are income-based. If you manage your taxable income carefully in early retirement, you may qualify for significant premium reductions that make the bridge much more affordable. The catch: Roth conversions count as taxable income and push your ACA premiums up. Every dollar you convert is a dollar that raises your healthcare bill. That is a real trade-off you need to model before converting. The FIRE movement has produced brilliant thinking on safe withdrawal rates. The ACA premium calculation is one of the last remaining blind spots in most early retirement models. Model it explicitly before you pull the trigger. Now, long-term care. Most people push this topic out of their minds because it is uncomfortable to think about. That discomfort is one of the most expensive financial decisions you can make. The US Department of Health and Human Services estimates that 70% of Americans who reach 65 will need some form of long-term care during their lifetime. Long-term care means help with daily living activities, bathing, dressing, eating, mobility, when you can no longer manage independently. This can be a nursing home, assisted living, or a home health aide coming to you. The median private nursing home room in 2025 costs over $100,000 per year. That is from the Genworth Cost of Care Survey, one of the most comprehensive datasets on this topic. A full-time home health aide runs around $70,000 per year based on current national averages. Still a significant number, but considerably less than a facility. Average care duration is 2 to 3 years. 2.5 years at $100,000 per year is $250,000. That is on top of every other retirement cost we have discussed. Medicare barely covers long-term care. Short-skilled nursing stays after a qualifying hospitalization. That is it. Any ongoing care beyond that, and you are funding it yourself or through insurance. So here is the updated retirement formula. If you are currently using 25 times annual expenses as your target, let me show you what it is actually missing. Baseline, annual expenses times 25. Spending $60,000 per year. Your base target is $1.5 million. Same calculation as before. That part is correct. Add healthcare. $315,000 for a couple, roughly half of that for a single retiree. You are now at $1.8 million for the couple before anything else. Add a long-term care buffer, $200,000 as a conservative starting point to self-fund 2 years of care. You are now at $2 million for the couple. If you are retiring before 65, add the ACA bridge premiums, $18,000 to $25,000 per year for 3 to 5 years. That is another $75,000 to $125,000 on top. Someone targeting $1.5 million on $60,000 per year in expenses may actually need $2 million or more. That is a $500,000 gap between where most plans stop and where the real number is. Now the action plan. A bigger number only matters if you know what to do about it. 5 concrete steps. Step 1. Open a health savings account and max it every year you are eligible. The 2025 family contribution limit is $8,300. Individual limit is $4,150. The HSA is the only account in the US tax code with a triple tax advantage. Contributions go in pre-tax. The money grows tax-free. Withdrawals for qualified medical expenses are tax-free. No other account does all three. The underused strategy. Invest your HSA balance instead of spending it. Pay current medical costs out of pocket if you can afford to. Let the HSA compound for decades. The balance becomes a dedicated healthcare fund at retirement. Save every receipt for out-of-pocket medical expenses you pay now. There is no time limit on HSA reimbursements. At retirement, you can submit those old receipts and withdraw the equivalent amount completely tax-free. Step 2. When you enroll in Medicare at 65, also enroll in a Medigap Plan G. It closes the unlimited 20% gap and protects you from catastrophic out-of-pocket exposure that Medicare alone leaves open. Step 3. Healthcare gets its own dedicated budget line in your retirement plan, completely separate from living expenses. Healthcare inflation runs 4 to 5% annually. Model it separately, or your projections will drift every year. Step 4. If you are retiring before 65, model your ACA premiums at multiple income scenarios. The Kaiser Family Foundation Subsidy Calculator is free and takes about 5 minutes. Use it before you finalize your retirement date. Step 5. Have a real conversation about long-term care before you turn 60. Long-term care insurance premiums are dramatically lower when you are young and healthy. After 65, premiums spike significantly, and some people cannot qualify at all. If long-term care insurance does not fit your situation, explicitly earmark a dedicated reserve in your retirement savings, $200,000 or more, as a self-funded long-term care account. Either way, You need to plan for it deliberately. Here is where I land this. The 4% rule is not wrong. The 25 times expenses formula is not wrong. Standard retirement math is built on solid principles. The problem is what gets left out. Healthcare is the largest single expense that most retirement plans do not have a dedicated line item for. That omission compounds over decades. The number you are working toward is probably $300,000 to $500,000 short of where it actually needs to be. Once healthcare costs, long-term care, and ACA bridge premiums are fully accounted for. That is not a scare tactic. That is information. And you now have it early enough to actually do something about it. Drop a comment below with the retirement number you were targeting before this video. I genuinely want to see how big the gap is across different income levels and family situations. If this was useful, subscribe. I put out one video per week on the financial decisions that actually move the needle. See you in the next one.